Good evening and welcome to our Focus on Facebook Live. Here with me, Dr. Husnain Kermalli, Chief Medical Officer at St. Mary's Hospital here in Waterbury. Each month we are going to highlight one of our clinical departments, bringing you insights into the services and their capabilities that they're able to offer both here at St. Mary's Hospital and very importantly to the Waterbury community at large. I am extremely happy today. We've got our focus on neurosurgery. Definitely an exciting field. We always say, it's not neurosurgery. Well, today it is neurosurgery. Neurosurgeons, of course, perform specialized procedures in the spine, the brain, precision technology, state-of-the-art equipment to perform all sorts of procedures and manage multiple different injuries and diseases. We have a very unique relationship here at St. Mary's with the neurosurgery, orthopedics, and spine specialists. We lovingly refer to them as NOS, located just down the street. Here at St. Mary's, we are co-managing the neurosurgery service line with them, and really happy to report, both with the leadership from our OR department, along with the work that we've done with the NOS team, St. Mary's has earned the Joint Commission's Gold Seal of Approval for spine surgery certification. And to find out more about this exciting field and some of these certifications, joined today by Dr. David Forshaw from NOS, who leads our spine team here. Welcome, David.
Well, thank you very much for having me. I'm excited for this opportunity to talk to you and the community at large about what we can offer here at St. Mary's Hospital with NOS.
It is exciting. Let's start by explaining what our co-management agreement talks about.
Sure. So what the co-management agreement is an agreement that we, as the private practice community of neurosurgeons in Waterbury and the hospital, have been doing for 6, 7, 8 years now.
Yeah.
So a long time. So it's a very mature group that we get together monthly. We sit down, we talk about the good, the bad, and the ugly about the spine program here at St. Mary's. And over the years, through multiple iterations of this co-management, we have looked and improved across the board quality, patient experience, bringing new technologies into the field, streamlining the process, both from the time someone sees their primary care doctor with a complaint to get into our office, to get the diagnostics they need, and ultimately, if they need surgery, get them the surgery done in a friendly, compassionate, and state-of-the-art institution.
Yeah. When we talk about quality, tell us some of the quality aspects and quality, what we refer to as metrics, that we look at that determine whether, how do we say that something is higher quality? What are the metrics that we look at? What are the criteria?
Sure. So we look at a lot of different metrics. We look at things in terms of efficiencies in the OR. We look at how well we start our cases on time, how well the cases go, the speed of the surgery done safely, because we look at operative times and turnover times to make sure we can get people in, taken care of safely, and onto recovery. We also look at some of the, I don't say more common complications, but the complications that are known about.
Sure.
And we look at those and review those quarterly. We keep a list of every complication that occurs. We sit down and look at it in a multidisciplinary fashion, review it, and always are looking for ways to improve. We also look at other metrics for people, length of stay. We look at outcomes too. We track patient outcomes for how well they're doing. Did we accomplish what we want to accomplish with surgery in order to get them onto the next phase of their life and back to normal?
And so that leads me to think about things that are important to the patient, so that when you're talking to them, you can safely say, when they're going to ask you questions like, how long is the surgery going to take? How long am I going to be in the hospital? What are the complication rates? Through this program, are you able to give them more concrete answers that are reliable, that they can take back home and say, hey, I'm going to be in the hospital for a couple of days and my surgeon's going to do a great job?
Yeah, of course. Obviously, when you sit down with someone face-to-face in an exam room, or mask-to-mask now, you don't want to look them in the eye and give them incorrect data. You want to look them in the eye and tell them the truth, because it behooves no one to sugarcoat things. So if we can tell them the good, the bad, and the ugly, and get through the process together, you find you have much better outcomes for patients. So through this process, we have definitely increased our ability to confidently say what the outcomes are going to be. And that's important to patients because they want to know what to expect. And in that note, with this co-management program, we've also done brochures and information to give patients not just what they have to remember from the conversation with the neurosurgeon, which they might be overwhelmed with, and they get a lot of information. So
it is neurosurgery after
people
all.
do, understandably get all freaked out by that
Yeah.
interaction. So we give them, written pamphlets to go home with. We have information on our website, on your website, to really communicate, because it is a shared decision-making model. It's not just me telling them what to do. It's a dialogue between the two of us and all my partners to get the patients involved in their care, because you have to get buy-in. And by working with the hospital, we get buy-in from the hospital, working with us, with my team and the patients. When you have three people trying to get the same outcome, it really gets much, much better results.
And from a results perspective, I know we look at both the quality side of things, but one of the other things that's very important to me personally is, how did the patient experience go? Not necessarily, they were here for 2 days, but what's their response from a patient experience perspective that we look at together? Could you share some light on that?
Sure. So we obviously are very interested in feedback, right? That's the world we live in.
Yes.
It's based off of feedback and reviews and metrics. So what we do is...
And likes.
Exactly. So what we do is we both talk to them in my office for their visits and follow-up visits, and then there's a liaison from the hospital that calls each and every patient personally to go over with them how their experience was. And then we take that information, again, go back to our quality group and our monthly groups to try and figure out if there were shortcomings we see, how we can improve on that to make the next patient's visit all the more special for them.
Fantastic. I mean, so to go over this, and we'll talk about this, it sounds like patients are not only talking to you and within the doctor office, but we're calling them through this co-management agreement outside of all of that to say, hey, how did it go?
Yep. There's the other touch point of, there's an outside company that we also use to get more data. I don't know if you know this about neurosurgeons, we tend to be type A and driven and data oriented. So the more information we can get to improve, the better we're going to be. So I love when we see our scorecards and our dashboards and all these metrics. It excites me because the vast majority of the time, everything's green and good, but there's always a couple more percentage points you can strive for to continue to improve, and that's what this process does. It leads to continued improvement in an already, top-notch program.
Great. So when we say Joint Commission certified, what does that mean? How does that translate to the patient?
It means we chose to bring an outside third-party person in whose job is to pick apart programs and find fault, to look at us under a microscope over several days to tell us how we did. And we did very well. We got their gold seal of approval, which is, we're one of the few hospitals in Connecticut who have this high-level designation. So it means we care about quality, we care about experiences, and now we can go to the patients and say, look, it's not just us, but this other outside group also agrees with how good of a job we're doing.
Yeah. And we've both sat through some of these processes. We've got outside, third-party, still neurosurgeons, if I'm not mistaken. They are experts in their field who come through and evaluate nuts and bolts all the way through.
Yeah, they will actually walk through a patient day from check-in to the OR to recovery room to check out, look at the documentation, look at the nursing education, look at the pamphlets we're given to go home with. And it's a very important thing that we really get multiple touch points for the patients, because the patient just doesn't see me and my shiny face. They see more time with the nurses, with the receptionists, with the transporters, with the therapists. So we get buy-in across the board from everyone in this hospital to really make sure that that patient has the best, safest, and most efficient process once they come in here for their potentially life-changing surgery.
Yeah, and the big thing for me is, number one, it's safe, and number two, it's gold level, which is huge, because that shows us that we are at that level. What are some of the other distinctions that we also have within the program?
So we also are, one of the big things we do is we're in all the work comp panels. So that means multiple employers, the state, the cities all trust us with their injured workers. So that's another big touch point. And again, it's outside validation that we are doing the right thing for these patients. We're also in the process of looking at a Blue Cross certification to get another level because, again, we like accolades. We like awards being told, not just from our patients, but from outside people that we're doing the right thing for people.
And I think that's the other piece is not only we are ready and getting prepared to allow people to come and evaluate our program. That's how much confidence we have that we're going to be able to pass these distinctions to be able to take that next step.
We're an open book. Take a look.
We are ready to go. So I want to talk about a little bit more on the actual neurosurgery component as well. What kind of issues, say generally, would cause somebody to come and see you? Why would their primary care physician say, you need to go see Dr. Forshaw?
Sure. So as a group, we take care of the gambit of patients with neurologic conditions. They can range anywhere from chronic neck pain, arm pain, low back pain, weakness, numbness, tingling, anything that can cause a significant enough disability in someone's life that they want to see if there's something that can be done for them to improve their quality of life.
Okay.
And we, again, run the gambit from start a little physical therapy and some medications, injections, to surgery. So we offer a comprehensive package of care for patients who have some type of disability that's significant to them. And then as neurosurgeons, we also take care of traumatic events. So we take care of all the traumas in the city of Waterbury as well. Someone comes in, God forbid, with a traumatic injury, broken neck, a bleeding on the brain. We also take care of those injuries. They would see us not through the office, obviously, but in the emergency room.
Right.
We also take care of brain conditions too, whether it's brain tumors, trauma, infections, those type of things that in general people aren't as happy to see us, but they're happy with the care and the results they get from this comprehensive approach we take toward the patients.
Right. So we talked about brain, we talked about neck, we talked about spine. What are some of the more state-of-the-art, like this is very interesting that we're doing, very cool in my view,
Sure.
That your team is able to bring to the table?
So we have, again, a very thoughtful approach to seeing the patients. So we're all board-certified neurosurgeons. There's 4 of us in the community.
Right.
Myself and Alan Waits and John Struger and Judith Gorlick.
Yeah.
We're all exceptionally well-trained from major academic places in the country, and we've all come here to practice.
Yes.
What we bring to the table here is both the skill set and then with some of the technologies that we have at St. Mary's. So one of the big things that we've brought in here a couple of years ago was the ability to do navigation. So there's basically 2 ways that we can do surgery on the spine and brain safely. One of them is through navigation. The other option is through robotics. As an institution, we've made the choice to work with navigation as our platform because, not to be dismissive of robots, but all they do is make your hand make a straight line. I think as a neurosurgeon, we can make our hands make straight lines.
Sure.
So the navigation lets us basically create 3D models of people's brains or spines so we can know where all the important anatomy is ahead of time and then navigate around it so we don't go near the scary stuff.
Yeah.
And what it does is lets us do our surgeries through smaller incisions with less tissue disruption to promote faster healing and faster recoveries. In fact, one of the things I'm kind of proud about that I didn't get a chance to tell you about or the institution about was the other day I did one of the first outpatient 360-degree lumbar fusions here.
Wow.
We did surgery on someone's low back. He's had multiple low back surgeries. Came in at 7:30, did his lumbar fusion, instrumentation. He was done at 9:30. He was home at 11:30 in the morning. So before lunch, he had a 360-degree fusion done at this institution.
Wow.
At home.
Congratulations.
Eating a sandwich.
That is awesome.
Yeah.
That is
so
fantastic.
that was one of the things we've just done here. So we're starting to push the envelope safely, but trying to really get people in, taken care of, and out of the hospital. Especially with the times we live in now, people want to spend as less time in a hospital as possible.
And we want them to be able to get that excellent care within our institution, get taken care of as efficiently and safely as we can, and get them home. And if we can do that within half a day, awesome. That he can be having lunch at home without having had his breakfast before the surgery. That's awesome. Dr. Forshaw, I appreciate you coming out. Thank you so much for having us tonight. I'm excited to where our teams are going to go together, our hospital, your group. St. Mary's and NOS with our co-management is going to take Waterbury to that next level.
I think we're already Mostly there.
We are there,
Keep working.
and we keep working
Exactly.
forward. Thank you so much, very much.
Thank you.
Thank you all for participating, and we will see you next time. Have a good night.